Thank you to all four of you for being champions. And you've given us some great ideas for kind of communication and dissemination strategies. And we're really excited to hear about some of the areas where you see gaps in recommendations in the science and the evidence where this committee can really help you continue to be champions. If there's particular areas where you're not seeing reports or recommendations or a clear summary of the scientific evidence, that may help us to guide the roadmap for action that we've been asked by the Robert Wood Johnson Foundation to help develop. So if you have anything very specific that we can provide to champions, that would be really helpful for us, because as you've seen, our statement of task is quite broad, and so we absolutely need your help in helping to focus and narrow that towards areas where you have particularly seen a need for additional information coming from scientists that are on this committee at the Academies. So thank you again for being champions, and we'll move on to Senator Steiner Hayward.
Thank you so much. And the hard part of my life is following Representative Kagi anywhere, because she always has so much depth of experience and wealth of ideas to share. The good part is it means I can talk less. So I'm Elizabeth Steiner Hayward. I am a family physician by profession and a state legislator by avocation, which has been a surprise to me. It's not what I expected to do with my life. I have the privilege of serving under my wonderful department chair, Dr. DeVoe. And I have been in the legislature only 7 years. I don't have anywhere near Representative Kagi's wealth of experience, depth of experience. But one of the most interesting things that's happened during that time is I've discovered that I'm a budget geek in disguise. Because really budget is policy, right? And I firmly believe that states' budgets should reflect the values of the people who are paying the taxes, ultimately. And that's the way I frame it a lot of the time. I currently am the Senate, in Oregon, all of our budget committees are joint between the House and the Senate, and I currently am the Senate co-chair of the Health and Human Services Budget Committee. And as a result, have a lot of purview over many of these areas that impact the youngest Oregonians. I'm also currently serving on the Governor's Children's Cabinet. The Governor Brown, about 2 years ago, convened a children's cabinet with agency directors from the Health Authority, the Department of Human Services, Education, Housing, pretty much Department of Justice, any area that affects the well-being of children in the state. It was a little nebulous and vague, and I was a little frustrated because she didn't have any legislators on there. And one of the things I'll tell you is that if you have a group of people who are getting together to try to create policy that you want to move forward by legislation, it's always better to have legislators at the table up front, because they can tell you where the barriers are going to be before you get your policy crafted and help you figure out ways around them. So the sooner you engage the actual policy makers in the conversation, the more likely you are to be successful. That's sort of one of the back end questions first, but I'm going to put that out there. Long and the short of it is the governor was planning on reconvening this, and I convinced her of two things. The first is she needed a couple of legislators on there, and it needed to be one from the House and one from the Senate, and one Democrat and one Republican, because again, when you have both chambers involved and both major parties, it helps you move things forward faster. The second is she was going to talk about early learning, and I said to her, Governor, you know, most people in the legislature and in the real world, when they think of early learning, they think of 3- and 4-year-olds, and I'd argue that's too late, and that we really need to be talking about 3- and 4-year-olds in the context of the first 2,000 days, and certainly the first 1,000 days in particular. And when I explained to her some of the data, she's a smart woman with a strong background in children's issues, but not the same level of science. She's a lawyer. And, you know, she really got it, which was to her credit. And so I've had the privilege of working with her and a group of, I have to say, really, really smart, committed agency directors and policy people from the executive branch, and my colleague, Representative Stark, who's a Republican from a rural community in Southern Oregon, and who's a strong advocate for kids' issues for about the past 6 or 7 months now on these issues. We broke the area down into about 4 topics, 4 domains that we ran work groups on over this past 4 months now. Housing, because clearly if kids don't have a safe, stable place to live that their parents can afford, that's one of the things that we know contributes to early childhood trauma and interrupts learning. Childcare and very early education, so developmentally appropriate childcare, affordable childcare. Oregon has a huge issue with childcare consuming enormous parts of people's income. Healthy families, which we described as home visiting programs, parenting education, and parental and two-generation approaches to mental health and substance use disorder treatment, and early education itself, sort of the 3 and 4-year-old range in this. And I focused primarily, I was running the Healthy Families work group, so I'm going to talk a little bit about that area first. And it's interesting that Dr. Duncan talked about Durham Connects, because one of the biggest proposals coming out of the Children's Cabinet going into the 2019 legislative session is universal home visiting using the Durham Connects model. And one of the biggest arguments and we're planning a 4-year rollout over the entire state. We have about 45,000 births a year in Oregon, about half of them on Medicaid. One of the interesting things about the Durham Connects model that is very important is that it is truly universal. It is offered to every woman while she is in the hospital after giving birth, regardless of socioeconomic status, regardless of insurance status. And that's important because it sends a message that parenting is tough for everybody, right? And I freely use myself as a model. I was 32 years old. I was a practicing family physician with a supportive spouse who was a proven good parent because he already had a kid when I had my first child. I had severe undiagnosed postpartum depression. I was alone in Oregon, essentially without any family support, and I had had pretty crummy parenting myself. And it was the worst winter that we had on record in Oregon in about 50 years. So, and my baby was born at the end of December, right? So the presence of a smart, committed public health nurse in my life would have made a huge difference. Now, that baby turned out just fine, as those who know her now can attest, and everything worked out okay, but you can't say that for every family, right? So we have to have a conversation about the fact that parenting can be tough for everybody, and that this is truly a health intervention. And I think one of the other points I would make is that framing is really important. Representative Kagi mentioned that a lot of people are reluctant to have government going into people's homes to tell them how to parent. That's not what this is about, right? This is about highly qualified public health nurses who are among the most trusted professionals on any study that is ever done about trustworthiness of professions, go in and do a formal assessment of how things are going and what the needs are. And then, as Dr. Duncan pointed out, make those connections to services as appropriate. And so framing that as a parenting is tough for everybody, and this is a health intervention because it's going to keep your baby out of the emergency department in the next 2 years. And let's make sure that where your baby's getting appropriate developmental screening, you're tied in with a great child health provider, family physician, nurse practitioner, pediatrician, whatever it is in your community, and that you know what resources are out there that fit your needs as a community. I asked my colleague, Representative Bonham, who's a Republican business owner from the Dalles, which, for those of you who know Oregon, is about a third of the way along to the Idaho border, about 100 miles east of Portland, and to be on this committee because he's very committed to early childhood issues. And he initially was very apprehensive about this model until he was able to articulate what the challenge was, and we were able to say, look, our hope is that the whole thing about Durham Connects is that it's a community-based organization, and you have to have a community group of advisors. And the point there is you use the resources that are available in that community, because almost by definition, the resources that have grown up in a given community are ones that that community will accept, right? Whether those are faith-based or philanthropic-based or government-based, it doesn't matter as long as they're evidence-based, right? And that's the conversation that we need to be having. So framing is really important. And it's totally reasonable to talk about economics, right? Those data on the ROI, just in terms of emergency department visits are what are going to probably get all the commercial insurers in our state to commit to paying for this program too. Because when you've got a 3.5 to 1 ROI in the first 2 years of life, that's something that the insurance companies can see very quickly. So understanding, one of the most important things to do is to understand different ways to frame arguments and to assess really carefully up front what your audience needs. And people say, well, isn't that shading the truth or, fibbing? And it's not, right? You have to speak language. It's like you don't use the same language when you're talking to a 2-year-old that you do when you're talking to a 40-year-old, right? We all change our language. We all code switch one way or another on a regular basis. So I would talk about that. I intend, frankly, to learn from my peer and advisor, Representative Kagi. We're going to be bringing Phil Fisher, who's another great local expert from the University of Oregon, up to help meet with the insurers. I'll probably bring Phil and Pat to come meet with a bunch of legislators in January to talk with them and do exactly what Representative Kagi did in Washington to do that, because we have the Oregon Community Foundation, which is the big, large philanthropic organization that's significantly interested in this. So I want to add 2 things in terms of barriers to what Representative Kagi said. The first is data sharing, and that has to do primarily with data systems. In Oregon, Washington did a great job 15 years ago or more, starting to do much better integrating their data systems. We're behind in Oregon. If I told you how many COBOL-based green screens there were in our state, your hair would curl. And it's really frustrating. And data systems are expensive, right? And figuring out good data integration is expensive. So you have to be able to convince people that in order to measure the effect of the programs you're doing and ensure that you are actually meeting your promise of saving money, that you can track these things. So the data investment is important. The second piece has to do with regulation around privacy. And we were talking about this bill, and Jen DeVoe and I had dinner last night, and we were talking about the challenges that we face with HIPAA regulations and FERPA, and I mentioned 42 CFR Part 2, which forbids people which treats data around substance use disorder and mental health differently from physical health data, which all of us who are physicians in the room would say is complete hooey, right? So we really need to be working hard on streamlining that. I passed legislation in 2017 to actually require our Department of Justice to work with all the agencies that collect personal data to develop clear training guidelines about what you can and can't share. Because I got to tell you, the level of agency myth out there about what you can't share, that basically is like the games of telephone that we played as children, astonishing, right? Why can't you share that? Well, my supervisor told me so. Well, yes, the supervisor. Well, my supervisor told me so, right, when I started. And it just gets expanded and expanded. And people tend to put, as we say in Judaism, fences around the law, and they keep making it harder and harder to share information. So we've asked the Department of Justice to work with all these agencies to develop standardized training, standardized release of information forms that every agency uses that allow the agencies to freely share information with the protection. And ACLU, who is usually the most concerned about this, was totally fine with it, because we knew that we were going to be operating in the law. So those are 2 things that I think it's going to be really important to include as part of this conversation about some of the big barriers that go toward implementing programs like this. They're not very sexy. They're kind of abstruse for some people who don't understand it, and they're really, really important. So I'm going to stop there and be happy to take questions after my colleagues have done speaking.
Thank you very much, Senator Steiner Hayward.